Well, good afternoon. My name is Dr. Brad Mechor, and my practice at the Calgary Sinus Centre is dedicated to treating the most complicated nasal and sinus patients from across Prairie provinces. Our nose is the greatest air filter ever invented and the first line of defense for our respiratory system, protecting us from dust, smoke, pollen, allergens, pollution, and countless virus, bacteria, and fungi that we encounter every day. One of the most important things we can do for our health is to use a nasal rinse to remove dried mucus, irritants, and help clear the nasal passages. It's like mouthwash for your nose. The neti pot was invented 5,000 years ago as a part of yoga practice, and in 2016, Canadians spent $90 million on nasal care products. Unfortunately, current nasal rinses are not ideal. First off, they can be inconvenient to mix, and they require a clean source of water, and I tell patients to use boiled and cooled or distilled water, as using tap water can lead to further serious infection. Current rinse bottles are poorly designed. They have an inner cannula that draws the solution out of the bottle, and this has been shown to cause contamination and infection. And they don't completely empty, leading to wasted solution. And that's not a big deal if you're just using salt water, but as soon as you start adding medications to the rinse, you're throwing your money and your medications down the drain. Current rinses have a fixed volume of 240 milliliters, and many people find that's quite uncomfortable. They feel like they're drowning or even being waterboarded. Current nasal rinses use sodium chloride as their main salt, and this can lead to further drying after the initial rinse effect is worn away. In the last 10 years, I've treated over 30,000 patients telling them to use my competitor's product, many of them not liking it for various reasons as listed above. So for those nasal and sinus sufferers dissatisfied with current inconvenient and somewhat ineffective nasal rinses, I'm happy to introduce Rhinoclear, a nasal care product that offers convenient and effective nasal care solution. Unlike products on the market that are inconvenient to mix, can lead to further drying, infection, and irritation, Rhinoclear offers the only pre-made, clinically proven effective nasal care solution and ergonomically designed bottle to reduce waste and contamination. Our solution will be produced at Chief Medical Supplies in Calgary, has a composition similar to seawater into our body's plasma, and has been shown in clinical studies to be superior to sodium chloride that our competitors use. Our bottle, which will be produced at Alberta Injection Molding in Airdrie, has an inverted design for allowing for complete emptying and a specialized coating to reduce the risk of contamination and infection. And because our solution is pre-made, you'll be able to choose any volume of solution that you want for your daily rinses. My goal by creating this product is to keep patients out of my clinic and keep them healthy. We'll initially sell through my office and local pharmacies to reach the general population, ensuring that we can meet the demands of production and shipping before moving to larger outlets. Proceeds from this competition will go towards the development of samples for people in my office, as well as working with the Calgary Fire Department to ensure their members are taken care of and gain endorsement for our product. Thank you.
Thank you very much. Judges.
Just help me understand, is the innovation the device itself or the solution you're using, the ingredients, or both?
The solution is the biggest thing, certainly being pre-made. It's much more convenient for users. And then the development of the bottle with a few changes will add to that as well. With our rinse, because it's pre-made, if you don't want to use my bottle, that's fine. As long as you buy my solution, you can use the solution in anybody else's rinse device.
John Connolly, just tell me in a moment or in a minute, what is your scalability strategy? I see you've got a filing for a patent.
We are currently patent pending both in North America and Europe, and we have the ability to grow beyond that, I think. We'll initially start selling through my office, and we currently sell about 500 NeilMed products per month. We see between myself and my partners about 500 patients per week in our office selling them the rinses. Beyond that, we'll move to local pharmacies to ensure that we can get to the population, making sure we can meet the demands of shipping and production before moving onwards from that.
So in the 30,000 patients you see, how many of them can you sell Rhinoclear to?
So essentially, all I do is treat nasal and sinus disease. So essentially, every one of them should be using this product.
So if so, what kind of revenue do you think you can generate with your 30,000 patients?
So if we have 30,000 patients and each patient were to buy 6 containers of 4 liters of solution in a year, we estimate a cost between $15 and $20 for a sale price with a production cost of under $2 per 4 liters. So if we're making $15 per 4-liter container, multiplied by 6 by 30,000, and that's just in my practice alone. So I think with chronic sinus disease affecting 20% of the population, It's a huge amount of people that could benefit from this product. Not only patients that I see, patients suffer from allergies, asthma, people working in healthcare sectors such as nurses, in a hospital setting, respiratory therapists, people using CPAP machines at home, school teachers exposed to little germ factories every day in elementary school could use this regularly.
So you've partly answered my question in terms of the volume of the market.
Yep.
But what proportion of the population would benefit from this solution, and how would you propose to tap into that?
I would like to say that everybody should be using this on a daily basis. Like say mouthwash for your nose, it's just good for your general health to use this on a regular basis. The hard part will be getting that out to the general population. Certainly when Dr. Oz was on Oprah several years ago, they did push that and it became popular after that. Brett Wilson is a good friend of mine who is where the waterboarding statement came from, so benefiting from exposure like somebody like Brett or Paul Brandt who did the voiceover on my video would certainly help as well.
Thank you very much.